Hi, I'm Chad Myeroff with TwinCitiesShoulderAndElbow.com, here to talk to you about a really common issue that affects a lot of Americans, bone-on-bone shoulder arthritis. Now, shoulder arthritis tends to happen over decades or certainly years, where the shoulder can become really stiff, really painful, and it can be very disruptive. Now, normally the shoulder is like glass on glass. There's cartilage on cartilage, it's very smooth, of course painless, and gives you lots of range of motion to lift overhead and do all kinds of sports and activities that are really important to us. When shoulder arthritis occurs, it's a loss of that cartilage. All of a sudden it becomes bone on bone, and that pain comes from that sort of grinding that can result. And that can oftentimes also lead to significant stiffness as well. Now, it's important to know that while this injury does occur over decades, when it gets bad enough that you are looking for options, they do exist. First off, the first thing you want to do is avoid aggravating activities, consider anti-inflammatory medications if your stomach allows, or a steroid injection, which can bring down inflammation for up to 3 months. Early on, when you have decent range of motion and it's not too bad, physical therapy may be helpful. I always warn people, if it's really painful and stiff, sometimes physical therapy can be more aggravating than anything else. So it's all about considering it, but not necessarily pushing through the pain. That said, in some cases, all these modalities can be helpful and can help delay ultimate surgery, but total shoulder replacement remains a good option for when it becomes this disabling. Now, there's several options available out there, but it's important to know that while it's not as common as hips and knees, shoulder replacements do have a very long track record, and the technology is actually improving rapidly over the last several years, and there's some good options available too. I tend to prefer a shoulder replacement with these stemless implants. They're designed to be a little bit bone preserving, a little bit smaller incision, and less blood loss. Also, as you compare them to the previous models, there's just simply a lot less interaction between the implant and the bone, so a little bit less area for there to potentially be pain or loosening. Now, that said, no matter what technique you use these days, even though we're always pushing the limits on the best possible implants for you and technology of how to use those, that surgery does involve general anesthesia. Most of the time it involves removing the front rotator cuff, which would be attached to the ball here, dislocating the shoulder, and then once the surgery is complete, where we've replaced the ball with metal and the socket with plastic, repairing the rotator cuff on the front. For that reason, total shoulder replacements do have some restrictions for the first 3 months. So you're in a sling for 6 weeks, and you can't lift the arm on its own power for 3 months because we need that rotator cuff to heal. Once that rotator cuff heals, there's generally not any profound restrictions. We do prefer you sort of drive it highway speeds, so to speak, so keep things light, do what you need to do to have a good, fun lifestyle and get back to work. But generally, we like to avoid really heavy lifting because it does add some wear and tear to the shoulder. The things we're trying to delay or eliminate is the risk of things loosening or wearing out, or the rotator cuff giving way, which can occur over time. Within 10 years, there's a 90% chance your total shoulder is still working just fine. And within 20 years, there's an 80% chance that it's working just fine. While surgeries may be needed later down the road, in general, patients find very high satisfaction in return of function, pain control, and range of motion. And it's important for you, if you feel that you're getting to that point, to have this discussion. You meet with a shoulder provider who really understands what you need out of your shoulder, but also the technology available. Total shoulder replacement is a really good option if you're at that stage, but just remember, there are things to do to help delay that or potentially even eliminate the need for a replacement. It's important for me that you get those understandings. And I recommend you come in and see us. Visit us on TwinCitiesShoulderAndElbow.com. Book an appointment both virtually or in person so we can better understand how to get you back to the highest level possible.